Hello everybody, and welcome to the Tuesday edition of Video Clips. I hope you had a wonderful Thanksgiving. We certainly have much to be grateful for. Those of us who are well fed and safe, I mean, that's something to be grateful for every day. I'll start with some answers to questions that I have had on the YouTube channel, and things that are just too much to write about, easier to talk about. The first one pertains to a question that's been asked a lot of times: the role of food in childhood behavior, such as conditions like ADHD. And food does play a role. I mean, malnourished, dehydrated people don't think well, and for those of us who even eat a very healthy diet, if you don't eat enough and you don't eat on time and that sort of thing, it's like, I tell people, it's like somebody took the batteries out of my head if I'm 2 hours late for lunch. So the way that our children are fed with bad food and breakfast at 6 in the morning and lunch doesn't happen until 12:30, it's no wonder that they do have some trouble sitting still and focusing. But having said that, I think it's very important to remind people that there is no such thing as a chemical imbalance in the brain that is causing childhood ADD and ADHD. Focus, discipline, to sit still, complete tasks, etc. These are learned behaviors. In other words, it isn't by the luck of genes that some of us came out of the womb knowing how to do those things. We were carefully taught to do those things as children by our parents and our teachers and that sort of thing. So if something has happened and for whatever reason a child really has not been taught those skills, the child can be taught those skills. And my business partner, Peter Bregan, would tell you that and show you how he does it if you take some of our courses. He's very clear about how he accomplishes that goal. One thing that is important in terms of the way I think we should be approaching childhood ADD is we're so quick to say what's wrong with this child, and I think instead we need to look at what happened to this child. I mean, what happened that the child is acting out in this way? What happened in that the child never learned how to behave in this way? I think the worst thing you can do to a child is prepare the child to feel like damaged goods or a victim of something he can't control for the rest of his life, which would definitely affect everything from happiness with family and involvement with community to education and job prospects. So I really think that it's important that we do the right type of intervention with children, and I don't think that drugging them is the right thing to do. I do think that diet and a health-promoting diet is the right thing to do, but I think by itself it often is not the solution to the problem. Another thing is I did another video clip with a very long article called "The Remarkable Uselessness of Statin Drugs," and some of you made comments about, well, are you saying nobody should take them, or you wrote in about your particular situation and should you take them? And what I would answer is that, first of all, you should not trust anybody who would tell you to take or not take a drug on YouTube channel. I mean, come on. And there are people who benefit from statin drugs. The key is figuring out if you're the person who benefits. Most people benefit from a great deal, or I should say, some people benefit from a great deal of what we do in medicine. The problem is the misapplication of medical tests and procedures, and that's what we're going to talk about today, actually. But you don't want to throw the baby out with the bathwater, and because the widespread prescribing of, in this case, statin drugs isn't a good idea, you don't want to jump to the conclusion that it's a bad idea for everybody. What you want to do is get to that gray area where clinical judgment is involved. And I think one of the worst mistakes that's ever been made in medicine is the propensity to abandon clinical judgment and basically say, if the blood test says this, we do that. And then the blood test results that are set as parameters are increasingly influenced by the drug companies. So the message that I'm trying to get across is for you to have the right type of investigation and conversation so that you know if you are a person who would benefit from a particular thing that I'm talking about on YouTube. So I hope that helps a great deal. A couple of other announcements. Those of you who have breast cancer coupons that you earned for signing the pledge, we sent out an email to everybody saying November 30th was the deadline. I've had a couple of emails over the weekend indicating that some of you are like, oh my gosh, can I still redeem my coupon? And we'll honor them for another week. So if you want to turn your $100 coupon in and get a special price on one of our courses, you can still do that till the end of this week. And of course, Christmas cookies, I should call them holiday cookies to include everybody because they are neutral in that regard. We're shipping boxes of a dozen of these delicious, phenomenal cookies to any place in the continental United States, $19.95 per dozen. that includes the shipping costs. And they're beautiful gifts packaged in a beautiful tin. And we'll include a card. You can tell us what you want us to put on the card. I'm getting ready to send to all of my business contacts and good friends around the country who look forward to these. And in fact, if I don't send them, I will generally get some emails from people saying, gosh, we sure did miss the cookies this year. Hoping you're going to send them sometime soon, and et cetera, et cetera. So anyway, take us up on that offer to do some of your holiday shopping and shipping for you. And last but not least, we're really looking forward to a great 2020 with so many interesting, phenomenal courses that we're going to be offering, including our new vaccine course, which will come along with the types of handouts that you need to provide with legislators and provide to legislators and others who you need to communicate with about this issue. So if you're interested in pursuing those courses, or if you are interested in a career, we have programs for people who have already had healthcare training and are looking to reorient themselves toward more of a business like ours. And we also have training programs for people who have no healthcare training, including a wonderful course that is what everybody wishes dietetics was. So if that interests you, send me an email at pampopper@msn.com. I'm happy to set up a time to talk with you personally on the phone, send you some information to consider, and share with you what we've learned about this in the years that we've been in business. So it's official. Stents and bypass surgery are useless for most people. I've been talking about this for 25 years, but the research is really showing this to be the case. So by way of background, stents are small wire implants that are used to open up blocked arteries. They can save lives for patients who arrive at the hospital during or shortly after a heart attack. The problem is that most of the stenting procedures involve people who have no pain and discover that they have a blocked artery due to imaging, or people who have chest pain on exertion. Almost 2 million stents are implanted each year. The cost is somewhere between $11,298 and over $36,000 per procedure. For a long time, going way back, it's been suspected that stents were being overused, causing harms to patients, and also burdening an already very economically bloated healthcare system and incurring billions and billions of dollars every year in expense that we really can't afford. Research dating back to 2007 showed that stents did not reduce the risk of death, non-fatal myocardial infarction, or hospitalization for acute coronary events. Research also showed that stenting does not produce better outcomes than less invasive approaches, such as just taking drugs. The AVERT study, which involved randomizing patients to take Lipitor or have angioplasty, showed that patients who just took the drugs had fewer heart attacks, less chest pain, and made fewer visits to the hospital than those who had angioplasty. Some studies even compared stents to placebo and showed that there was no difference. One study that included 200 patients involved using a catheter to reach the blocked artery, but when that happened, only half of the patients were given a stent, and the other ones that just withdrew the cath, and there was no stent implanted. 6 weeks later, no difference between the two groups. Patients in both groups said they had less chest pain, and both groups did better on treadmill tests. A meta-analysis published in 2012 showed that stents were useless for most patients too. 3 of the studies included people who had already had a heart attack, and 5 looked at people who had stable coronary artery disease but no previous events. The analysis showed that patients who received stents along with drugs were no better off than those who were just prescribed drugs. Now, this is a particularly stunning finding, this and the AVERT study, in view of the fact that the drugs are fairly useless. For example, one study showed that taking Lipitor reduced the risk of a heart attack by only 1.1%, and another showed that it's expected to increase your lifespan by about 3 to 4 days. I mean, those are pretty dismal results. So if no better off than this to have angioplasty, I think we can write it off the list for most people. Well, in addition to the uselessness of the procedure in most cases, angioplasty and stenting can cause harm. Often the inflating of the balloon nicks a plaque and causes the toxic ingredients to be released, which then activates clotting mechanisms, and the result is between 15 and 20,000 heart attacks and 10,000 deaths per year, actually during the procedure. Now, to be fair, some of these are high-risk patients, but killing a high-risk patient with a procedure that's designed to save his life, maybe you should think twice about whether or not to do the procedure. Yet another study confirmed that stenting is useless for people with stable coronary artery disease. Conducted at 5 sites in the UK, all 230 patients were taking typical medications that are prescribed for people who have coronary artery disease. The patients were then randomized to either an intervention group, which received stents, or a group that was sedated for 15 minutes, during which no procedure was performed. 6 weeks later, all patients participated in a treadmill test in order to check their symptoms of angina. No difference between the patients who had stents versus those who were in the control group and didn't get the stents. In spite of the ongoing release, I mean, it's been like a drip, drip, drip of studies over the years showing that stents are ill-advised for a significant percentage of the people who are getting them. Over 1.8 million stents are still implanted each year in the United States, and this is an ongoing problem. The information that is revealed in well-performed studies just doesn't translate to what happens in a clinical setting. Well, a new study now shows that not only are the stents indiscriminately used and shouldn't be, but also that bypass surgery is overused too. The study, called ischemia, included 5,179 patients who were followed for an average of 3.5 years. They had moderate to severe blockages. Many suffered from chest pain regularly, and all were treated with various combinations of drugs for cholesterol and blood pressure, aspirin, and drugs to slow heart rate for those who had severe heart disease. Anti-clotting drugs were given to the patients who received stents. As in previous trials, patients were randomized to take drugs only or to take drugs and have cardiac procedures. In that intervention group, 75% of the patients got stents and the other 25% had bypass surgery. In both groups, the death rate was just about the same, 145 in the intervention group and 144 in the meds-only group. More patients in the medication-only group had heart attacks, but the difference was not statistically significant. Lead researcher Dr. Judith Hochman told the New York Times that the research group anticipated that patients with the most severe chest pain and blockages would certainly benefit from the procedures, but, quote, there was no suggestion that any subgroup benefited. Well, that's about as clear as it gets. The procedures are useless for most people, yet in the United States, we still perform about 500,000 bypass surgeries every year. Now, to be clear, do stents and bypass surgeries help some people? Yes, they do. Do they help most people? No, they don't. One of the reasons is that coronary artery disease is systemic and it affects the miles and miles of blood vessels throughout the entire body. So doing something to relieve the blockage in an artery close to the heart or a blockage with a stent doesn't really do anything about the rest of the plaque throughout the body that can rupture and cause clots. Thus, outcomes are not changed much for people because the clots can develop other places in the body even after having bypass surgery and stents. And it's a remarkable thing that you can have a very expensive procedure fraught with risks and walk out of the hospital or the cath lab and you're no better off than before when you went in. While many of these studies have shown that medical management with drugs is as effective as procedures, research has also shown that diet and lifestyle change is more effective than drugs for many, many patients. In addition to better efficacy, you don't get the bad side effects, and it's less expensive, and dietary changes have this, I call it the breadth of effect, which means that if you have chest pain and you have high cholesterol and your blood pressure is high and you're overweight, adopting an optimal diet will address those issues, but it'll address all the other bad things that you don't want to see happen too, like the development of type 2 diabetes or autoimmune disease or cancer, and et cetera, et cetera. So the breadth of the effect is truly remarkable, and gosh, if we had a drug like that that could affect so many things, it would certainly be $1 billion or $1 trillion drug. So, just the importance of being informed. Again, the gray area of healthcare is where we want to live. And that means that you have to take into consideration a person's family history, medical history, current state of health, diet and lifestyle habits, tolerance for risk. So many things go into making decisions about important things like, should I have angioplasty? Should I have a stent, bypass surgery? Do I qualify? Am I going to be helped? So many things go into making that decision. And unfortunately, the standardization of medicine, which originally sounded like a great idea, we'll come up with some kind of cookbook for humans, like an operations manual for a car. You turn to page 34, and it says if this light comes on, you take it to the dealer and do that. Well, humans aren't like cars from a mechanical standpoint. There's just a huge amount of variation. So learn to live in the gray zone and learn to engage healthcare professionals that are willing to visit that zone with you so that you can achieve the best healthcare outcomes. All right, if you're not a subscriber, hit the subscribe button. And as usual, pass this on to anybody who you think would enjoy watching it. And I'll be back to you on Thursday with more news.